Our next speaker is Simin Meydani, who is the director of the Jean Mayer USDA Human Nutrition Research Center on Aging at Tufts University. She's going to speak on healthy aging, and I think, frankly, at least for me, there's not a whole lot of rationale to living to be an older person unless you can be healthy, functional, and have a great quality of life. And I heard Simin give a version of this talk just about a year ago, and I think you're in for a real treat. Simin?
Thank you so much, Gordon, and the committee for opportunity to speak here. I'm going to have to apologize because somehow I thought I had more time than I have. I guess your eye sees what you want to see. So I'm going to have to skip through some of my slides, so I apologize for that. So the good thing is that I don't have to go through some of the introductory material, because you all know that the population is getting older, and that means that there's going to be increase in incidence of many of the age-associated diseases at a great cost to the society, as well as in terms of the healthcare economics. And so it becomes very important to develop strategies that we can enhance the health span of older adults and help them live longer lives, but healthier lives, not necessarily longer life. And that becomes very critical, both socially and economically. So in order to develop strategies, we need to first define what is successful aging or what is lack of successful aging. And there are two concepts that I want to talk to you about that has gone through evolution over the years. The first concept is that when we started this, we thought that there was a separation between aging and age-associated diseases, that they ought to be studied separately, and that age-associated diseases were inevitable consequences of aging, and that they were controlled totally by mainly by genetic factors. Now, that we have come a long way around and have accepted that, first of all, we can't really separate aging and age-associated diseases from each other. They are different, but they are totally related. For example, cardiovascular disease goes up with aging, but it can also cause aging of the arteries. And the other important factor is that we now understand that genetics might not be having as important a role as have lifestyle and other environmental factor, which is good news in terms of being able to intervene and change the course of and the trajectory of aging. So, and then key really to developing strategies to promote healthy and successful aging is defining what successful aging is. And maybe I'll give you the punchline now before I tell you why I have come to this punchline. And that is that, we've come a long way in terms of defining successful aging and its component, but we are not there in terms of coming up with consensus as to what components are essential in terms of successful aging and how do we go about defining them. But we are pretty close and have come a long way. So early definition of successful aging were really focused on lack of diseases or absence of negative attributes. But today we are coming to understand that healthy aging is not really the opposite of aging with disease or functional impairment. And one of the first people who came out to define that were Rowe and Kahn when they, based on their MacArthur Research Network of Successful Aging, they described successful aging as involving freedom from disability along with high cognitive, physical, and social functioning. And that's one of the first times that people started looking at it in that way. And then later on, 10 years later, they added resilience to this definition. And by resilience, they mean the ability to really adapt to unpredictable events, such as loss of a loved one, or if you get mugged. I mean, how quickly do you get back on your feet when you see those things? And doing that, then they came up with some modifiable factors that would influence successful aging, and that included carbohydrate metabolism, osteoporosis, cognitive function, which included social support, bereavement, and relocation. And you can see the role of nutrition in some of these things that are listed here. And then later, NIA and White House Conference on Aging and the WHO also have emphasized that healthy aging goes beyond absence of disease and disability. And then more recently, the Canadian government has even gone a step further and has added to this whole list of things quality of life and enhancing successful life course transitions. So now you can get a sense of how holistically we're looking at successful aging. And others, of course, have come up with other definitions. The one that I like is the last one, which says morbidity-free until the latest time point before death. In other words, live happily until you drop dead. So that's, I think, That's all we all wish to do. So now, based on this, then there've been attempts to try to see what are some of the factors that contribute to successful aging. So Tyra Wallace recently looked at determinants of successful aging together with assessment of dietary habits in relation to healthcare facility use among elderly populations that were living in the Mediterranean area. They had about more than 2,500 elderly ages of 65 to 100, and as I said, they were different islands within the Mediterranean basin. And they used 3 domains in terms of evaluating healthy aging. One was low probability of diseases and disabilities. Second was high cognitive and physical capability. And then social factors, active participation through social activities. And they basically thought that this multi-domain would give them a better way of evaluating the relationship of risk factors to successful aging. And so they came up with a 10-point index of successful aging that you can see includes many of the different indicators that we talked about. And you can see what they, in terms of the result, and I'm happy to tell you how they came up with the scoring each of them, but there wouldn't be time for me to do it now. But the summary of the result is that higher score of successful aging, meaning taking all of those things together into account, was associated with less use of healthcare services. And the interesting is that with a 1/10 unit increase in successful aging index, that was associated with 0.8 less times a person used the healthcare services or sought consultation within a 1-year period. So that's, I think, a pretty good relationship. And what I'd like you to do is to look at some of the different parameters that they look at, the 3 domains that they looked at here. And what you can see off the bat is that the lifestyle characteristics were the main contributor to successful aging. Accounted for 48% of the variability, and then clinical factors 38%, and then 23% was psychosocial factors. And I think what is very important is to note that both the Mediterranean diet score and frequency of daily exercise were pretty high in terms of contributing factors to successful aging. Now, Depp and Jeste then wanted to use some of these ways of defining healthy aging to come up and say, what is the percentage of successful ages within US? So they took a whole bunch of studies, 28 studies, and that had used different definition of aging, and then looked at them to see what they would come up, whether there is agreement in terms of the percent of successful agers within US. And right away, you will see that it's really a very heterogeneous finding. I mean, there is, the percent of successful agers identified in these different studies are quite varied. And one thing that I'd like you to notice is the darker bars. Those are the rates that, those are based on self-reported successful aging by the older adults themselves. And you see that those are pretty high, and we'll get back to that later. So they identified some of the sources of variability, which was main factor among the variability was definition of successful aging and its components. So you see how important it is that we come up with an understanding of how do we define successful aging. And then another factor was that who was the unsuccessful group that they compared with. And that was important. And now also a bias toward studying negative outcomes contributed to some of the low successful aging rates that we see. From that study, one of the strong supporters for, some of the strong supporters for predicting successful aging were absence of arthritis, hearing problems, better activities of daily living, and not smoking. And then moderate supporters were higher exercise, better self-related health, lower systolic blood pressure, and so forth, and so on. And then some of the limited support was for higher income, greater education, current marriage, white ethnicity. I guess having more money doesn't mean you're going to be happier or living more successfully. At least this is what we like to think, but there's evidence for it. So then other studies have also done similar things to try to look at the literature and come up and decide what are the contributors to successful aging. Peel used 8 studies from 341 papers. They were mostly American studies and all community older adults. And what they found was that the definition of healthy or successful aging really ranged from focusing just on physiological and biological factors to more holistic approach and comprehensive approach that contained factors such as biopsychosocial models. And what they found was that despite this very wide range of definition that were used, there were certain things that was routinely used in all of the definition, and those included functional independence, measured as ability to do daily activity of daily living, and less frequently was used tests of physical performance, cognitive ability, and absence of diseases and psychiatric morbidities. And we'll get back to that in a minute. So what they came up from their review was that what domain they used and how they were aggregated together influenced a lot the result of the finding of the study. So from the behavioral determinants from their study that determined that was associated with healthy aging, these are the factors that they rated high in terms of normal weight, physical activity, not smoking, moderate alcohol, not being depressed, and more social contact. And you'll see more of that in a minute as well. So you can see now that they're taking a holistic approach and looking into successful aging, and many factors are coming out. Now, Young et al. Recently took this a step further and put in the measures of self-assessment of health into assessing how we determine successful aging, and came up with these 3 different domains that overlap with each other and contains both physical as well as sort of social elements. So this is really interesting. In their study, what they're finding is that social connectedness is very important in determining how cognitively functional we stay. So this is a little complicated, but what it is that the 3 lines show the extent of your social connectedness. The solid line is limited social engagement, and then the 2 dotted lines are extensive and average social engagement. And of course, if to begin with, even at age 50, there's quite a difference between the 2 groups. If you are more socially engaged, you have better cognitive function. But what is also more important is that those who have limited social engagement have a sharper decline as they age in terms of their cognitive ability. So pointing out to the importance of social engagement. So what we're now saying is that really we're no longer questioning in terms of, and actually this is quite interesting, because from this another study, they concluded that being connected to social groups had the effect of reducing the cognitive age of an 80 years old by 9.5 years, which is quite important. So now we're not just saying that it's important to have social connectedness. What we are focusing on is that what are some of the key elements of social connectedness that contribute to successful aging? For example, is it having social meals? Is it other factors that is contributing to that? And that's what we need to sort of focus on. And so another way of looking this is what Justin et al. Have done, which is to try to break these domains of successful aging into objective definition and subjective definitions. And what they're finding is that most older people do not meet objective criteria for successful aging, while a majority of them will meet the criteria for subjective aging and a subjective criteria for successful aging. And I think that is something that you'll see becomes very important. So this is a way of showing that in form of data. You can see that if we look at absence of diseases, for example, only 15% of people would meet that criteria. But if you look at things like independent living, being happy, all of that accounts for about, then we would say 90 or 94% of people think that they are, happily and successfully aging. So the criteria that you use is going to be very important in terms of how you define successful aging and how your intervention will be effective. And what is interesting is that there's really a gulf between how older people identify successful aging as opposed to how researchers and their physicians do that. I mean, researchers and physicians define successful aging as more objective measures and lack of disease, whereas for older people, issues such as adaptation, meaningfulness, connection is really what is important to them. So the question is that who should really define successful aging? Should we be defining it, or the older people, or the two of us, all of us together? And these are some of the factors that older people think is important in terms of successful aging. So we are in desperate need of having longitudinal studies of reliability and validity of subjective ratings of successful aging. And that's something that is lacking. Another area that, as I've been looking through this, that we're lacking is really good measure of what are the contribution of nutrition in terms of successful aging, because many of these studies don't really have a good way of assessing that. So to conclude, and I apologize for having gone too fast, but at least I'm going to stay in time. So over the last 50 years, the definition of successful aging has really evolved from one that has been focused on the absence of diseases and disabilities, in other words, objective negative outcomes, to one that includes psychosocial domains that are more subjective and reflect well-being from the point of view of the older adults. And while there is overlap among the different definitions of healthy or successful aging that is proposed up to date, there is also a debate on which components are essential and who should really be defining it. And having said that, though, I think there are some themes that come out through looking at all of the ways that successful aging has been defined. And these themes are that high physical activity, cognitive and social function engagement is the common trends that you can find among all of these different ways that we are defining it. And you don't see nutrition here, and I think it's because people haven't really studied nutrition the way they should be. What they do is that either do a food frequency or they look at BMI. I mean, there hasn't really been a good way of assessing nutrition, and that's also a gap area. So while there is good consensus on how to assess physical and cognitive health, we really don't have a good way of measuring and objectively defining social function and engagement, and how do we use it in terms of assessment of the effect of interventions. And in order to do that, we really need to have a close collaboration, much more than what has been done so far, between the biomedical scientists and psychosocial scientists, together coming up with definitions that is workable. And in doing that, we need to have input from older adults themselves. I mean, that's the part that we have all sort of forgotten about, and so sort of have gotten caught up in our own world without paying attention to the person that is most important. And I think we need a lot more research in order to define early determinants and risk factors for key components of successful aging. And that is important if we are to come up with unified definitions, and if we are to use them as a way of assessing success of interventions. And in that regard, particularly, I think nutrition has been overlooked. We do not have included good measures of nutritional status in many of the studies that have looked at successful aging. So, and just to show that, oh, I'm sorry, I think that somehow this is all messed up, but the point of this is, and I'm not sure why, maybe it's a Mac to PC problem, but the point of this was to show you the importance of nutrition, because when they look across the different cohort studies and try to compare the result of finding from their cohort, which was in Hawaii in Japanese men, with other cohorts such as the MacArthur cohort or the Alameda County cohort, to try to find common factors between the groups. And the factors that, the three top factors that came up in terms of important for successful aging were all related to nutrition. And they included, high blood pressure, obesity, and then blood glucose levels. Other factors were smoking, alcohol, and so forth, but the three top ones were all related to nutrition, again, indicating that we really need to pay attention to that. So I want to just finish by showing my parents, who I believe, have successfully aged. My father actually died last August at the age of 98, and he did exactly do that. He lived healthy and happy, and only for the last couple of weeks of his life, he wasn't feeling well. And my mother is still alive, 94 years old. And I'm happy to tell you that she has successfully aged, but not as well as my father. And I could tell you why that there are some of the difference between the two of them, and that are related with what we have discussed. So happy to answer questions if there's time.
Thank you, Simin. Any quick questions? Tim?
Tim Mork with Nestle. Simin, thank you for that nice overview. Just to ask you the question I was going to ask Dave a minute ago, he had on his slide, and you touched on it, it was called Nutrition Management of Disease. Mm-hmm. And that's something that I think we need a real emphasis on. There are a lot of government hurdles that are keeping us from getting that full recognition, but I think that's a really important component, and I think you laid it out very nicely.
Yeah. No, I do agree. I think that nutritional management of disease and also just in general, nutrition for promoting, healthy and active aging is important. And unfortunately, I was trying very hard to find ways that, I was hoping that I'll be able to come and show you a lot of data related to nutrition, but I'm sure we're going to be hearing more throughout the day. But unfortunately, many of these larger studies have not done a good job in terms of defining nutrition in a way that it should be, and could result in could show the importance of it, because I can't see how we could have good, for example, cognitive function. How could we have good functionality in terms of muscle, in terms of your immune system, without having good nutrition? And why it does not show up in some of these studies, except for the Mediterranean study that showed a very strong correlation, is because we haven't done a good job in terms of assessing it. And that's an area that I hope that within this 1.5, 2 days, we can come up with a better understanding of and a better way of promoting inclusion of those type of really good measures of nutrition among these studies.
Okay, well, thank you.